I had been a nurse for many years, and I felt like I wanted to do something more to impact more people than just the people that I was taking care of in my area. And I had a lot of experience to share, so I wanted to go in a different direction.
So originally I had wanted to become a women's health nurse practitioner because I thought that was the next step. As I started studying, I realized that I didn't want to do just patient care. I was really passionate about coaching new graduates, participating in research projects, finding new ways of doing things, evaluating current methods, and seeing how I can improve those outcomes.
I'm very clinically inclined, and I love to help nurses, especially new graduate nurses, develop their practice. So for me, the clinical nurse specialist role is the ideal opportunity to do all of those things at an advanced level and really bring all the things that I'm particularly passionate about together in one role.
I always explain a clinical nurse specialist as a nurse engineer.
We're kind of everything, but we are advanced practice nurses. And while we are similar to our NP colleagues, we actually operate in what we call the 3 spheres of influence. So we have a tremendous amount of impact on nursing and nursing practice, on systems and organizations, and on patients and families.
How a CNS practices can actually vary. You may practice more in one sphere than the other. The traditional role really encompasses all 3.
So we are different from other advanced practice nurses in that we get to practice in all those spheres, and it's a more holistic approach.
Sometimes we collaborate, we bring in other people to the table so that we can create an effective process that will impact the patient outcomes, as well as it makes the nursing process more effective.
We're kind of the people that look at that 30,000 view to sort of see, are we looking in the right places? Are we doing the right things?
He or she usually is a leader and an expert in a specific clinical area. They also can focus on specific populations, for example, geriatrics.
The clinical nurse specialist role is much better role for a specialty, and the nurse practitioners are more like generalists.
A lot of times they can be in a consultative role when there are complex issues with patients that are hard to solve on their own for nurses at the bedside.
So not only are you a specialist in an area of expertise, but the nursing staff is going to recognize you as such, and you will be there to support the nurses and help to mentor them and guide their practice and help bring the most recent evidence to the bedside.
Working where I do, I have a lot of CNS mentors around me. A lot of them have graduated from the Kent State Clinical Nurse Specialist program. All of them spoke very highly of the program, spoke very highly of the faculty.
Some of the teachers that we had were all clinical nurse specialists, and they really challenged us. They pushed me.
I chose Kent State because I've heard such wonderful things about the program, and every other CNS that I had talked to previously, they had gone to Kent State, and so I thought that would be the best route for me, and I am so glad that I did. The other thing that I really liked about Kent State is that the program was 100% online, and that worked really well with my work schedule.
So students can take our courses any location that, from their own house. They don't need to live in Northeast Ohio. It's also asynchronous, and that means that you can do the coursework at your own leisure.
Even though we are an online program, you will not feel like you're kind of out there on your own. You will see your faculty present in your courses. We try to connect with students in other ways as well.
When you begin your practicum courses, we will do at least one one-on-one video conference with you during each semester. And when you're getting into the second and third course where we do the projects, you'll get that one-on-one feedback with your faculty meeting with you and your preceptor together via video conference.
We really got to do a lot of interaction with our instructors to really help develop our thinking, our critical thinking, and how we need to look at situations and what we're getting right and what we're missing. So I felt like by the time that I finished, I had a well-rounded experience and kind of could take on anything. And even if I didn't know something, I knew I could figure it out.